Hello, viewers. I'm Dr. Raza, and today's topic is just not medical. It's a fundamental truth of human life, a truth that we only realize when even a small part of our body breaks. Yes, human bones, the skeletal system. We walk, we run, we sit, we stand, but we rarely stop to think what is allowing us to move at all. And when a bone fractures, that is the day when a person truly understands that the real foundation of the body is the bones. But the questions are, if the bone breaks, how long does it take to heal? Can a fractured bone return to original length? And if there was no muscle, what role would the bones have left? And the most deeper question, why was the rib cage designed the way it is? What kind of shield is this that protects the inside of the human body? We will understand all this today in detail. So stay tuned and don't leave. Watch the video till the end. An adult human body has 206 bones, but these 206 bones are not placed randomly. They are highly organized. The human skeleton is divided into two major groups. Skeletal groups, number of bones, bones of the region, and purpose. Axial skeleton, 80 bones in there. Skull, spine, ribs, sternum, central structure of the body. Protection of organs is the job, posture, main support. Appendicular skeleton, 126 bones. Arms, legs, shoulders, and pelvis. Body region, body's movement systems, and purpose. Walking, running, lifting, daily motion. The axial skeleton is like the central pillar of a building. Without it, the body could not stand upright. The appendicular skeleton is the movement machine. It allows us to walk, run, lift, grip, and move. One protects, the other one moves. The human body is a team system. Every part has a role and responsibility. Babies are born with more bones, and this surprises many people. When a baby is born, they have more than 300 bones, but as they grow older, many of these bones fuse together and eventually become 206. Why? Because babies fall often. They lose balance while learning to walk. Their bodies require flexibility and softness. If a baby's bones were as hard as an adult's, they would fracture constantly. So in childhood, bones are softer, flexible, shock absorbing. As a child grows, calcium increases, cartilage hardens, bones thicken, strengthen, exercise, strength increases gradually. This is nature's intelligent development plan. Now, bone cannot work alone. Bones only provide structure. Movement is done by muscles. Without muscles, bones cannot even stand straight. Think of it like component role. Bones provide frame and structure. Muscles is like an engine which causes movement. Joints, hinges, causes bending points, tendons, ropes, muscles to bone connection, and ligaments stabilizes bone to bone support like rubber bands. Now, if muscle becomes weak, pressures shift to bones, joints become stressed, and pain and stiffness begin. This is why exercise is the number one factor for strong bones. Calcium alone does not make bones strong until muscles are strong enough to support them. Sometimes your father comes home and says, "Son, press my legs, they're hurting." You press the muscles and the pain decreases. Did the bone heal? No. The muscle relaxed, blood flow improved, nerves calmed. Similarly, during fever, the body feels heavy, muscles ache, movement becomes difficult. Or when your brother stands on your back and still your spine doesn't break. Why? Because spine plus rib cage plus back muscles distribute the pressure evenly. This is the body's load distribution system. The rib cage is the protective armor of the human body. It protects the most vital organs, heart, lungs, liver, kidneys, spleen, stomach. Without the rib cage, even a small injury could be fatal. The rib cage has two qualities, strength and flexibility. Strength, which is protect the organs from damaging when during hits and falls, and flexibility, expand and contract with heavy breathing. If the rib cage was too hard, breathing would be impossible. If it was too soft, organs would be damaged easily. The design is perfect biological engineering. The rib cage is alive and working every second. Did you know that? The rib cage is not a static bony shell. It's a living, moving, flexible shield. During breathing, the rib cage expands, the diaphragm moves downward, lungs fill with air. While exhaling, the rib cage contracts, the diaphragm moves upward, lungs empty. We do this 12 to 18 times per minute, more than 20,000 breaths per day. The rib cage is a working non-stop machine 24/7 without us even thinking about it. It is always on duty, never takes a day off. Viewers, at this point, our discussion is no longer just about bones. Now we are talking about pain. This pain is not just physical. It is a combination of physical pain, emotional stress, mental stress, and breathing stress. Yes, we are talking about rib fracture. A rib fracture is considered one of the most intense, continuous, and exhausting injuries a human can experience because if your hand or legs break, you can immobilize it. You can apply plaster, rod, splint, support, blah, blah, blah. But the rib fracture, you cannot stop it from moving. Because if the rib cage stops moving, breathing stops. Meaning, in a rib fracture, every breath is equal to pain, every movement is equal to pain. Coughing causes stabbing pain, sneezing, shock like pain, even light pressure on the chest causes a wave of pain. Anyone who has ever suffered a rib fracture knows what I'm talking about. But why the rib cage is so important? The rib cage is like the body's armor and suit, but this armor is not made of steel, it's made of flexible living bone. The bone designed the rib cage between two extremes. If rib cage was too hard, breathing would be impossible. If rib cage was too soft, heart and lungs would be damaged from every impact. So the rib cage is strong plus flexible, perfect living shield. Inside the rib cage are organs that are essential for life. Heart pumps the blood, lungs supplies the oxygen, liver a metabolic factory, spleen immune defense, kidneys kind of a little lower but part of the ribs cover it sometimes cause the blood filtration, stomach and digestive system. Without protecting these, life cannot continue. This design is a direct protective system by nature. How do rib fractures happen? Rib breaks in two main situations. Sudden sharp impact like car accidents, motorcycle crash, falling hard, sports collision, a steering wheel injury. And number two, repeated internal stress like severe coughing, asthma attack, COPD flare-up, post-surgery weak bones, and osteoporosis. Yes, a very strong cough can crack a rib, especially if the bones are weak. The first and the most important sign, pain, but not just any pain, a specific type of pain. Rib pain equal to movement pain. Take a deep breath, it will cause pain. Cough will cause pain. Laughing will cause pain too. Sneezing, severe pain. Try getting up from a bed when you have rib fractures, it will cause you pain. Lay on the side, still pain. Even slow breathing hurts. Why? Because the rib cage expands and contracts with every breath. If one rib is fractured, every expansion causes the broken bones shift. Sharp, shock-like pain. Rib fractures pain feels like sharp, stabbing, or burning, deep, continuous, linked to breathing. The patient often says, "Doctor, it hurts when I breathe." And I always reply, that is the most important sign that you have a rib fracture. Symptoms and description. Severe sharp pain worsens with movement and breathing, difficulty taking deep breath, person avoids deep breathing, shallow breathing, body protects itself automatically, swelling and bruising at the injury site, clicking sensation, broken rib edges rub together. Shallow breathing itself is dangerous because when a person avoids deep breathing, mucus builds up in the lower lung. This increases the risk of infection, pneumonia, which can lead to ICU admission. Complications of rib fracture. If only 1 to 2 ribs are broken, the pain is severe but usually manageable. But if 4 or more ribs on the same side break together, this becomes dangerous. This condition is called flail chest, called medical emergency. What happens in the flail chest? Normally, during breathing, chest expands when inhaling, chest contracts when exhaling. But in flail chest, the broken segment moves opposite the rest of the chest, and this is called paradoxical chest move. This can cause lung collapse, low oxygen levels, heart pressure changes, and risk of death. Flail chest requires ICU admission, oxygen, and sometimes a ventilator with intubation. Internal organs damage risks. If the broken rib's sharp edge moves inward, it becomes an arrow. It can puncture the lung, called pneumothorax. Lower ribs fractures can damage liver, spleen, and kidneys. Upper rib fractures can damage aorta, which is a major artery coming out from the heart, and the heart itself. These are the life-threatening emergencies. Rib fractures are not minor injuries. Rib fractures treatment, the reality is many people ask, "Doctor, why don't we apply plaster on rib cages or rib fractures?" Answer, because if we stop rib from moving, we stop breathing. So treatment focuses on pain control to allow deep breathing, breathing exercises to prevent pneumonia, rest and supportive position to allow stable, and avoid tight bandages because it reduces lung expansion. Important instructions is deep breathing every few hours, cough with chest support, hugging a pillow, sleep at 30 to 45 degrees upright angle. The injury affects breathing, sleep, movement, everyday life. It is not just a fracture, it is a breathing injury. So what are the healing timelines for the rib fractures? If it's a hairline fracture, it takes 3 to 4 weeks. 2 to 3 ribs fracture takes 6 to 8 weeks. And flail chest, good luck, 8 to 12 weeks plus ICU. Pain is worst in the first 2 weeks. The bone heals in 6 to 8 weeks. Muscles and cartilage take up to 2 to 3 months. And confidence comes 4 to 6 months that it's okay to breathe deep and you will be fine. Viewers, now we are about to understand something very interesting, something that most people don't realize. But when they finally do, they say, great. God is great. The design of the human body is unbelievably intelligent. We are talking about bone strength and pressure. A bone is not stone, it's not wood, it's not metal. A bone is a living structure which is able to carry blood, grow new cells, repair itself, adjust its strength according to the environment. This means if you exercise, bone becomes stronger. If you don't exercise for years, bone becomes weaker. Bones adapt just like muscles, meaning use it or lose it. How strong are bones? Human bones are extremely strong, but whether they break or not depending on which bone is being hit, from which direction the force is applied, and how much pressure is focused on one point. Bone health, density, age, and nutrition also matter. It's not just weight that breaks a bone, pressure, speed, plus impact angle. To understand simply, if you slowly apply a force on a brick, nothing happens. But if you slam it against the ground, it breaks. Some bricks, same brick, but the difference, impact, speed, pressure, contact area. Bones work the same way. Now, examples of the pressure. To break a healthy human bone, you need 500 to 1000 pounds per square inch of pressure. Meaning, if that much force is applied to on a single point, the bone will fracture. For example, general bones, 500 to 1000 psi of pressure. Strong dog breeds like pit bull can break bone with bite force with that kind of pressure. Femur, which is thigh bone, 1700 psi, usually broken in high impact car accidents or major falls. Normal body weight cannot break it. Skull, 520 pounds of force, like hitting the head hard with a heavy object, cannot be broken by human hand. And collarbone, here, collarbone, which connects the shoulder to the sternum, 25 to 30 psi force easily breaks it, like in cycling falls, sports, tackles, or losing balance. So not all bones have equal strength. Femur is strongest, collarbone breaks most easily and the weakest. Forces versus pressure, most people misunderstand this. To break a bone is not about how strong the force is, it's about where and how it was applied. Example, place your body weight on your palm. What determines bone health? Vitamin D, sunlight, calcium intake, protein intake, regular exercise, hormones, age, and genetics. As age increases, bone density decreases. Bone becomes porous, becomes weak. This condition is called osteoporosis. Most common in women after menopause, elderly, people with lower sunlight exposure, and such people even strong coughing can crack ribs. Yes, just coughing. Now back to the rib cage. The rib cage is a flexible, strong shield. A healthy rib requires 3000 newtons of force, about 675 pounds to break it. A human hand cannot apply this. Rib fractures happen due to car accidents, falling from height, sports collisions, powerful strikes from trained fighters, and steering wheel impact in crashes. Why do ribs break during CPR? In CPR, the doctor must press the chest 2 inches deep. This is this much of a distance. This manually pumps the heart. This pressure is greater than normal rib tolerance. So in 70% of the patients, the rib break during CPR. And this is not wrong. If the rib breaks but the patient's life is saved, that is a success. The emotional pain of rib fracture. A rib fracture does not only cause physical pain, it mentally exhausts the person because the person cannot sleep properly, cannot take a deep breath, cannot laugh, cannot sneeze, cannot sit up normally. Even coughing feels like torture. The person develops a fear of breathing. If I breathe deeply, it will hurt. If I cough, I will scream. If I turn, the ribs will shift. This condition is called fear of breathing, and it's dangerous because the shallow breathing causes mucus to settle in the lower lungs, leading to infection, leading to pneumonia, which can lead to ICU stay. So the main treatment of the rib fracture is not plaster, it is breathing exercises. Healing process, stage, time, and experience. Inflammation, day 1 to 14, worse pain, bone. Healing begins week 2 to 6. Pain slowly reduces, callus formation, week 6 to 10 days, new bone bridge forms, and bone remodeling, week 10 to 16, bones become strong again. But emotionally, feeling normal while breathing again can take up to 3 to 5 months. Confidence takes forever to come back. So the real question, how do we make bones strong? Requirement and purpose and practical example, vitamin D, purpose, helps absorb calcium. Practical example, 20 to 30 minutes of sunlight daily. Calcium, building material of the bones. Obtain it from milk, egg, yogurt, and green vegetables. Proteins, builds muscle support like found in chicken, lentils, fish, and eggs. Weight training increases bone density like squats, lunges, and push-ups. And walking maintains mobility, 30 minutes daily. And most importantly, stop smoking. Smoking slows bone healing by 30 to 40%. This is scientific proof. The rib cage protects us every second. It never complains. It never rests. And it is our silent security guard. When someone suffers a rib fracture, they realize even breathing, sometimes we take for granted, is a blessing. So take care of your bones. Never ignore vitamin D. Keep walking and exercising and respect your body. Because life continues only as long as breathing continues. And breathing is possible only because the rib cage stands strong. If you like this video, like, subscribe, and share. It's important to know about your bone health. This is Dr. Raza. You're watching Dr. Raza at Health 360 MD. Your better health is my mission. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board-certified physician and diplomate of American Board of Family Medicine.